Hello, I am Peter, and on behalf of the physician educators at aesthetictraining.com, welcome to one of our Aesthetic Training Essentials series. Today we will look at the reasons behind advanced training and what it really means for you and your new career in aesthetic medicine. Let's get started. First, here's your 1-minute summary. Learning aesthetics is a skill, not a specialty. In a Botox and filler course, the skill is learned first in the classroom or in an accredited online curriculum with the anatomy, planning, and judgment for when and where to use toxins or fillers. Knowing what works best with the best patient retention is critical for a new provider. Then, in the hands-on portion, you learn how to hold the syringe and deliver the right amount of agent at the right depth in the right place. You are learning how to be a provider skilled in planning and designed to satisfy your patient's needs. You are not learning protocols or how to be a, quote, injector. The injection is the easy part. The consultation and planning is the skill. The problem is that there are only a few FDA-approved areas, and everything else is off-label. Many of these off-label indications are quite straightforward and work well. These should not be held back and taught in an advanced course for additional tuition. Other so-called advanced indications are just plain stupid and dangerous and will end up losing your business over time. But still, some enterprising training programs think you need to take those in a Level 3 course. Let's learn why certain companies offer advanced courses to earn additional tuition that will potentially harm your practice and reputation in your community. First, your training must be accredited for CME or CEU hours. That is essential. Then, the best training course is heavy on anatomy and the changes due to aging that we are trying to correct. Then, patient selection is crucial. A procedure done correctly but on the wrong candidate is still a poor outcome. You need to know what these substances are, how they work, and how they break down. And finally, once you are sure you have the right agent for the right patient, you need to learn how to design a treatment based on your patient's unique needs and anatomy, not based on a dosing map or a protocol. Then at hands-on, you need to learn how to hold the syringe correctly so you can deliver the right amount and the right depth and comfortably move on to the next injection. The motor skills here are pretty basic. The judgment and dosing matter most. For example, we have a number of indications that work and plenty that do not. They are broken down into the FDA indications, which are otherwise noted here as the 5-star indications. Most people are candidates for treating these areas, and they generally get good outcomes, although the forehead requires the most detailed assessment and customization of treatment. Then there are some off-label indications that work well where some people are candidates. These are the 4-star indications. Finally, the 2 or 3-star indications are limited not because they are advanced, but because they have fewer candidates and less predictable outcomes, even if you place the injections correctly. Still, all of these indications should be taught in the main or Level 1 course along with the design, but also the judgment on when to say no to non-candidates. Nothing on this page is advanced. The injection technique is basically the same for each treatment. Put the toxin into the muscle that causes the problem. Everyone should learn this in their first Botox training course. Withholding this information is an unethical cash grab by some training providers. Now here is where the upsell classes really make their money. Misleading their victim into the impression that these other indications are popular, work well, and free of complications. Nothing could be further from the truth. First, medical indications actually require one to use a different brand of toxin, require insurance, pre-authorization, and billing, and still may not work ideally. These are a mess on many levels. The indications with the star can be learned from peer-reviewed articles or from free training modules from the toxin companies. You don't need to pay for this even if you want to offer it on a regular basis to your patients because you have a pain clinic or serve niche audiences. Finally, there are the wild and crazy indications that are really just silly ideas, rather than indications confirmed effective and repeatable in clinical trials. Yet by suggesting that toxins work here, new providers, insecure in their ability to start a practice with their foundational training, sign up for these courses thinking that they can out-inject their competition because they have a bigger menu of services. It's like being a restaurant where you have 12 items on the menu that taste horrible and nobody wants. Why even bother, right? If you want, you can go to PubMed right now and look up any papers that might support these indications to confirm. They are few, and when you find one, it might have less than 10 patients at best. Don't pay to train in this. You can just read the articles yourself. Here is a side-by-side comparison of Botox training. First, from the American Academy of Facial Aesthetics, which sounds big, but is a dentist in Ohio with additional dentists and some nurses that also teach hands-on, and not one MD on faculty. Now, this company has the best dental Botox training, and if you are a dentist, you should check them out first. And as you can see here, they include TMJ in their basic course. That's good, and it suits their primary audience of dentists, but they are vague about what else is taught there. The answer is a little clearer when you look at the agenda for their Level 2 course. These are the good off-label uses, but there is nothing advanced about using a lower dilution. If you know where the muscle is, the lowest dilution gives the most precision. But they feel like the people who take the Level 1 course are not skilled enough to use a lower dilution. That's wrong. Make your Level 1 better then. Then in their Level 3 course, they add some really fringe applications and spend a lot of time on complication management. I wonder why. These 3 levels cost around $10,000, not to mention 3 different weekends and travel expenses. Now look at the class that is one of our top picks taught by Practical CME Medical Training. Practical CME has a refreshing philosophy that teaches everything that works and is desired by most patients in their Level 1 training course and hands-on. So basically, everything in red is what you learn in the first course. Practical CME has no advanced course. It covers everything that AFE Level 1 and 2 does and reinforces it with an accredited online curriculum that can be watched as often as you wish for 2 years, and it even gets free updates during that time. All of this for less than 1/3 of the cost of the 3 levels of training from others. In addition, there is a smaller group learning environment and guaranteed MD faculty as well. See, here is the problem. If you pay for an advanced course and some kind of right to call yourself an advanced or master injector, you want to put your new knowledge to work. Yet these applications are still fringe, and the results do not get better over time. Experience can't make an ill-advised indication work. So these advanced providers leave their training and push these treatments on patients because these courses don't teach you that most people are poor candidates. For instance, the lip flip has a satisfaction rate of well below 50% in people over the age of 40. So the group that has already lost the most upper lip volume is the one you should say no to the most. This is the most commonly botched Botox procedure that physicians see in their referral practices. Patients may have thought they hated their upper lip before, but now they hate leaking water out of their lips when they eat and drink. Neck bands technically work. Yes, the platysma muscle is unnecessary for function, unlike the orbicularis in the upper lip is really important for function. Some training programs teach using high DOS here. The problem is unpredictability of results for the cost. Patients hate their necks as they get older, yet most neck wrinkles and bands are due to skin laxity and not unconscious bulging of the platysma muscles. Bad results and poor value will cause patients to never return to you as a provider. You never want to chase additional profit from indications that don't work. Using scheduled time for touch-ups and complication management does not build goodwill or profitability. Losing patients will kill your reputation and your practice. The less you think about profit, the more money you eventually make, and you will do it ethically by making your patients happy enough to refer their friends. It is really the same story with filler. The judgment is in the patient selection and when not to use it. The main FDA indications work very well, and you can build a great practice from these alone. Surprisingly, some courses make you take Level 2 for lips, and that is wrong. Moreover, if they only teach injecting lip borders, like this stock photo, then you need to look elsewhere. Great lip results involve most of the filler going into the body of the lips along the wet-dry line. Otherwise, there really are not any 4 or 3-star off-label indications. Lips and folds for filler are what 90% of patients want and are anatomically correct. The hands-on is very straightforward. Learn how to hold the syringe and place a toothpick of filler at the right depth and repeat. It's like laying a single brick, and you have 20 bricks in each syringe to build small walls with. So once you know how to place a single injection, then everything else comes in the judgment of where to go next, the vision of when it looks even and when the treatment is finished. The big skill to learn is when to say no, and fringe indications, which are cheerfully taught in advanced courses, have really plunged some new providers into a lot of trouble and overwhelmed them when trying to start an effective and ethical filler practice. Tear troughs are universally lumpy and look odd since a clear filler cannot mask blue veins. Oh, and blindness can happen even with experienced providers. Avoid this. Cheekbone filler is a sure way to look fake or land spot on the next Real Housewives show. It is not anatomic at all. Same with weighing down a jawline or injecting noses which already have limited vascular supply. Some call blunt cannulas advanced, but they tend to deposit filler too deep and patients are less satisfied with the outcome. Finally, if you want to learn other non-hyaluronic acid fillers, you can these from the manufacturer once you have your foundational training. You don't need to take more training here, but realize that these other brands have less than 10% market share combined. You made it this far in life, so you probably did well in math. Here is the algebra of success equation. P times S equals R. Never heard of it, you say? Popularity times success rate gives you reputation. Popularity refers to what % of your patient base is a good candidate for a Botox or filler indication. Let's look at central brow Botox. 90% of people could benefit. Then this is multiplied by a 95% success rate for 3 months of results and no touch-ups needed. That gives a reputation score of 86. Power up, Mario. Now, in contrast, let's look at a lip flip. If you believe Instagram and TikTok, this is one of the most popular indications out there. However, only around 30% of people are good candidates, and half of them who do get the procedure would not do it again, or would need touching up. That is a horrible reputation score of 15 for you and your judgment as a provider. Game over. It takes a lot of time and effort to gain a new repeat customer, and unforced errors that hurt your own reputation will prevent your new career from growing. Here's how to build the best new career in toxin and fillers with the least friction along the way. Take the best small group hands-on learning you can, even if you need to travel. It's really not that expensive in the short run. Stay tuned. If you don't learn an indication in your certification course, then that is no big deal. Get really good at what your patients want and get great outcomes. 76% of patients will consider you their long-term primary provider after only 2 successful treatments. Now is not the time to experiment on them and lose them. Don't take someone's advanced course. Stick to the basics and do them well. Then, where you want to add more indications, just look up the studies in a reputable textbook, clinical trials on PubMed, or use the resources available for free from the manufacturers. This is true of medical indications like migraines. If you really want to learn a semi-permanent filler, you can learn it free from the filler company after mastering the basic linear indications, not from an advanced course costing thousands more. If you can inject Botox into a brow, or filler into a fold and get great repeatable results, you can inject in other places provided your patient selection and consent is clear and accurate. A lot of people still end up successful even in spite of bad training. Their own effort and perseverance allowed them to grow. But they started at a disadvantage and had to learn from their mistakes, while some of their initial patients went elsewhere and were not converted into long-term clients. People who push too many fringe treatments end up losing patients. Here is how those economics work out. Let's say you start your career doing mostly the high reputation score indications that work, and you're able to attract only 4 new toxin patients a week and 1 new filler patient. Now, that is not very much new patient activity, but it's okay. That careful provider will have an 80% retention rate and earn $40,000 more revenue in year one than the new provider who pushes fringe applications and only retains 50%. Now, how expensive does traveling to that one great weekend of training and avoiding wasting time and money on advanced training seem now? Thanks again for watching. For more videos, subscribe and check out our steps to success and provider summaries at aesthetictraining.com. Take care and thanks for watching.